Welcome to QD Clinic. I'm Jack Cush with RoomNow.live. RoomNow.live is the meeting you want to go to. Today's case is a Sawtooth steroid taper. How do I taper steroids? I'm sure each of you have your own little game, your own little rules. I can tell you that when you drop steroids down, if you drop too fast, the patient's not going to like it, and it drives up steroid dose and whatnot. The single greatest problem with withdrawing steroids is withdrawing them too soon and confusion of steroid withdrawal syndrome and the disease for which you're taking steroids. So assuming they no longer need to be on steroids, here are a few rules. If someone has been on steroids for less than a month, you don't need to taper. You can just abruptly stop. Basically, it's said that at 6 weeks or so of chronic steroids, you are going to suppress the HPA axis, and you could have steroid withdrawal symptoms and theoretically Addisonian crisis. I've been in practice 37 years. I might have seen one Addisonian crisis from a lupus patient taking 60 for many months and stopping it abruptly. But honestly, I've never seen it. So we're really talking about steroid withdrawal symptoms, which are aches and pains and nausea and vomiting and flu-like symptoms, and again, that's hard to distinguish from a condition like polymyalgia rheumatica or a flare of lupus or a flare of myositis. So these are my rules. If you're at above 20 milligrams a day, you should taper by 10 milligrams every 2 weeks until you get to 20 milligrams a day. And if you're at 10 milligrams or above, or above that, you can taper by 10 milligrams per week or every 2 weeks until you get to 10 milligrams. And then if you're above 5 or 2.5, you can taper by 2.5 between 10 and 2.5. But the thing is not to go from, when you're very high, you can go from 40 to 30 to 20 without much of a sawtooth change, and I'll explain that in a second. But once you start getting to 15 and below or 10 and below, you need to sawtooth your therapy. And what that means is, let's just say they were taking 10. And here, look at my graphic here. This is 10 on top. And then you want to go to 5. You can just go to 5 and they're going to get symptoms. But if you go 10 on Monday, 5 on Tuesday, 10 on Wednesday, 5 on Thursday, and you sawtooth for 10 to 14 days until they notice no difference between the high day and the low day. Then on the low day, you stay on the low day for another 2 weeks until you're ready to make your next change. So here, going from 10 to 5, that's going to take me 8 days, and then 2 weeks at 5 to stabilize, and then another 8 days. So basically, in 30 days, I could get from 10 to 0 using this sawtooth approach. Sometimes you need to do this when you're going from 15 to 10. You sawtooth it down to from 15 to 10. Or when you're going from 10 to 5. Sometimes you have to sawtooth it from 5 to 0. Those patients who are on 4 milligrams and can't get lower, you need to go by 1 milligrams, 5 to 4, and go up and down for 2 weeks, and then stay at 4 for 2 weeks, and then go 4 to 3, up and down for 2 weeks, and then stay at 3 for 2 weeks, so on and so forth. This I find to be the way in which you can get tolerable reductions in steroids, get them down to the lowest possible dose of steroids, and avoid steroid toxicity. But you have to educate the patient on symptoms they will expect. When they drop their dose, it's very likely that they're going to get symptoms, aches and pains. But steroid withdrawal symptoms only last, really, for most people, 5 days or so. They seldom last more than 10. So tell them, don't make your drop on a day that you need to be really active. Take it on a day that you can cut back your activity, that you can take some extra Tylenol and rest, and get over the hump, and then stay at the lower dose. This seems to work well for me. Hopefully it'll work well for you. Tune into more QD videos.